answer type describe radioulnar joint. And yes, there is a living anatomy question. So we are starting with practical. Demonstrate the movements of superior radioulnar joint. So first living anatomy, that is 5 marks, and of course I will come to theory. So first living anatomy, demonstrate the movements of superior radioulnar joint. That is a clear question examiner asks. Now how to communicate, I'm teaching you communication skill. Don't look at the examiner, just look at the examiner. Good morning sir, I understood your question, now I will follow. You understood how to communicate with examiner, and now your entire communication is towards patient. If patient is Marathi, you have to talk in Marathi. If Hindi, Hindi में अगर बात करना है तो हम बात कर सकते हैं. हात इधर रखिए, मराठीत हात इथे ठेवा, फक्त असं आणि असं करा. Yes, this is pronation आणि असं करा. Yes, supination. That means yes, these movements are normally done in this patient. You understood? I have demonstrated. So living anatomy question is over. I shown you how to communicate with examiner and at the same time how to communicate with patient. So while communicating with the patient, don't look at examiner, because sometimes students look at patient, look at examiner, look at patient, look at examiner. This creates a bad impression. Now coming to the question, what is the question? Typical question. Classify all the radioulnar joints and describe superior radioulnar joint as under ligaments, nerve supply, blood supply, movements. Of course, clinical is not asked because already the question is long. So we'll start with classify the radioulnar joint. Now while classifying, yes, I'll show you the paper also. Serial number, classification, superior, middle, inferior, and their type. So 3 radioulnar joint. Now look here. Superior radioulnar joint, pivot, enough. Middle radioulnar joint, yes, joined by interosseous membrane, fibrous, enough. And inferior radioulnar joint, that is pivot, again between radius and ulna, that is more than enough. Now coming to next, introduction. Of course, that is a formation of joint. Yes, that can be a heading also. How joint is formed. Now joint is formed between circumference of head of radius, look here, and radial notch for ulna and annular ligament. मतलब 3 involved है. Circumference of head of radius, radial notch of ulna, and of course annular ligament. Look here, ligament is taking part in the joint, so that is a complete formation of a pivot joint. So इतना लिखने के बाद along with diagram आपको 3 या 4 marks मिल सकते हैं. Now next, ligaments. How you write the ligament? Serial number, ligament, and yes, उसके peculiarities और उसका role. Yes, serial number, capsule. Serial number 1, that is capsule. What is the role of capsule? Of course, capsule is present in many joints. So role of capsule is stabilizing. Second, ligament, annular ligament. Yes, this is strong ligament and it adds to the formation of joint. So different role, every ligament different role. And third is quadrate ligament. It gives stability to the joint. So capsule, annular ligament, quadrate ligament. I'll bit slow. Capsule, annular ligament, quadrate ligament. If you write this along with diagrams, yes, underline along with diagrams, you may get 3 to 4 marks. So almost halfway we have reached. What is nerve supply? Median nerve, musculocutaneous nerve, radial nerve. Some people remember it as a MMR vaccine, measles, mumps, rubella. Forget that. Don't remember like this. Just remember median nerve, median, not medial, median, MEDIAN, median nerve, musculocutaneous nerve, and yes, radial nerve. बहुत ही आसान से मैं समझा रहा हूँ आपको. Blood supply on the lateral aspect of the anastomosis around elbow joint. On the lateral aspect of the anastomosis around elbow joint. I repeated this twice so that you will remember it. And main artery that the most you can write, that is the radial recurrent artery. That's enough. Yes. Now next part is a movement. Movement I have already shown you, supination and pronation. Supination, muscles producing supination. Again, how to write the movement? Serial number, movement, serial number, movement, and muscle producing movement. Serial number 1, movement, supination, muscle producing movement. Yes, biceps and supinator. Second, serial number 2, movement, pronation. What are the muscles? Pronator teres and pronator quadratus. Now, little bit of multiple choice question or viva question is asked. Which is strong supinator? A, biceps, B, supinator, or C, any option. Usually people select supinator, so that is not answer. Answer is biceps. So we have covered entirely the question. Yes, diagrams are necessary, and I told you last time where to draw the diagrams. Suppose you are writing about the capsules or ligaments, so draw the diagram immediately below the ligaments you have written. Don't draw anywhere. So कुछ स्टूडेंट क्या करते हैं, पहले बहुत सारे डायग्राम निकालते फिर लिखना शुरू कर देते हैं. No, there has to be sequence, there has to be frame of mind, there has to be purpose when you are writing the answer. I hope I am clear, and about clinical anatomy we shall make separate video. Thank you so much.